of every person in the class will be extremely difficult. Why? It depends on their perspective in which aspect they prefer learning. Followed, Maria? So that's why the
Yes.
sharings will also be different
Mm.
because we perceive.
Because I have a lot of friends and relatives who always say, "Why are you so have so many health problems?" And they seem so, I mean, older to me, healthier. Then I realized that they have so many other mental. I shouldn't call them mental problems, but still.
See, see, you took it in that angle. You learned it
Yes.
from that angle as an answer to your people who tell you that you are physically unwell. You learned that answer.
Yes.
Somebody else, Dilip sir will take it in somebody else, some another way. Everybody takes it from their perspective. In fact, the easiest word to understand is what use it is to me in my life. Nothing beyond, nothing less, nothing. How can I use it to my best? Right? Anybody disagreeing with it?
Yes.
Or it is like what is in there for me?
Mm.
Come, let us start with the class.
Good afternoon, ma'am.
Good afternoon, Sampana ma'am. Good afternoon. Welcome. So yesterday I told you all it is something known as clinical depression. Yes, this is my favorite slide. Knowledge is power, information is ammunition, and awareness is enlightenment. The ancient maxim, know thyself, applies to every facet of human existence, especially to one's health. The prevention, treatment, and management of illness and disease becomes easier and more effective when we are aware of the early symptoms of a medical condition, how to recognize those symptoms, and then how to go about getting the right kind of treatment. So, by this slide, what I want to only convey is that learn a lot about your disease, learn how to pick up the initial cues which your illness, which your indisposition is giving you, but leave the diagnosis, leave the management, leave the treatment part in the hands of a trained doctor. Do not just rely. I would say yes, you can refer to Dr. Google. It is just at the click of a button, but it is not a good idea to be going along with the medication management, just referring to Google, just referring to YouTube videos. Why? They may work once, but a doctor's degree is a doctor's degree. Hmm? And by these cues, you learn to nip it up in the bud stage, in the initial stages, and we do not allow it to catastrophize into something very, very serious and major. Hmm? So these camps are just for that. So depression is difficult to define. We learned a lot yesterday that it is very difficult to even pick up, difficult to experience, and extremely difficult to work one's way out of. Why? Is because suddenly when the doctor is thinking, now let me just give the green signal to this patient that you don't need to see me. You come once in 6 months. Okay. Now you're seeing me every week, then you're seeing me every 2 weeks, then you're seeing me once a month. But now you're doing really well and you come to me after 6 months, and the next day the what what case did I tell you all? The house, the relatives call up the doctor and say he has ended his life through suicide. Right? So these are the cases which shock the doctors also. Okay, it's very difficult to understand when to taper the treatment, when to taper the medicines. So we will be learning causes, symptoms, and diagnosis of depression, and we will be learning about management as well as treatment. In case you're struggling with mood swings, not all mood swings can be labeled as depression because they cannot be also labeled as bipolar. They are just mood swings, and once the precipitating cause is over, they just come back to normal. They swing back to normal. And if you're suffering from low self-esteem and complexes in life, which are prolonged in life, then you must consider getting yourself checked by a doctor, because sometimes prolonged grief and prolonged guilt can also lead to depression. When you know there is unresolved or unexplained guilt which the person is feeling, he's blaming himself for somebody else is whatever, maybe ending the life or whatever. But then you have to understand that can also lead to depression cases. And what are we going to learn in today's class? We are going to learn to manage the glooms and the dooms. I have lovely slides towards the end of the class for retired people, especially your age, and how they can be managing their lives beautifully and managing the day-to-day stresses, living stress-free lives. Okay. So, Asif, there is something which I'm going to explain, which is known as an emotional first aid toolbox kit. Isn't it beautiful to hear? Emotional first aid or band-aid kind of thing to your mind, what you should be doing, what you should be keeping ready, that when these episodes strike, do you think they come informed? Certainly they come uninformed, but when they come, you should be having a healthy outlook to life. You should be having the power to come back or out of it. So yesterday I told you all, I'm listening to a workshop. It is like 7th to today's the last day, and tomorrow's the encore day, where they will be giving us all the recordings. And what they said was that instead, what is resiliency? Who remembers what is resiliency? I told you all the meaning yesterday. Come on, now we are going to discuss. Pratibha Shinde was also there. Doctor, you will also discuss what point you liked in yesterday's class. Come on, Rita madam, you were also there. Carol was also there. Tala Purohit was also there.
To
Lakshmi
bounce
madam.
back, to bounce back,
To
to come
bounce
back.
back.
No, bounce
Yes,
forward.
And
after
what did I told you? We have to
illness.
replace that with bounce.
Forward.
Bounce forward. Should not be saying bounce back.
Bounce
We have to
forward.
Forward,
replace it.
sorry.
Yes, bounce forward.
And
Yeah,
recovery from setbacks.
recovery from setbacks. Beautiful. Yes, Nidhi, you have something to share about yesterday's class. Come on, Rita madam, think. What did
Overcome challenges.
Now we are done with the definition of resiliency. What did we learn from yesterday's class? What was your return gift? What was your prasadam? What did you take away from yesterday's 1 hour? We have to tell the newcomers. One point which you all learned. Should I remind you?
Who have studied the symptoms
Yes.
and types of depressions.
Yes. What did I tell you about the caste? If you
Yeah,
fracture, yeah,
caste,
that.
caste and outcast.
Caste and outcast, they don't understand. Dilip sir, share the whole line. If you break your arm, you can quickly go to
Outcast.
caste. But if you break your brain, then
You're outcast.
you become outcast. People do not like somebody who is mentally imbalanced. Right? Good. Anybody else who remembers another point? Share. You'll remember for lifelong if you share. Radha madam, Dr. Pratibha Shinde, Bolo. Carol, what was your takeaway point from yesterday's class?
Serotonin is made in the gut, and the precursor that helps is tryptophan.
Tryptophan. Okay? Yes. And tryptophan foods are there. Milk, paneer, tofu, those sticky kind of things, they contain tryptophan. Even cheese contains tryptophan. And then most of it is made in your gut. Right? What else we spoke yesterday? Sureka Kamat, what did we learn? Forgot?
In depression, we at times overeat, sometimes undereat.
No, I didn't get it. Just come again.
In depression, we either binge or vomit out, or we don't eat, we become thin or fat.
Yes, excellent. So you can't be saying that all depressed people will lose weight, all depressed people put on weight. No, it is each case which is individual, and because the sensitivity to appetite is affected. Right? Very good. Very good. Anybody else who remembers another point? The more you speak, the more you will remember. Hmm? We spoke a lot of extra stuff about a marriage also, but we'll not get into that today. So mood is sustained emotional tone. What is the definition of mood? Perceived along with a normal continuum of sad to happy, mood disorders are characterized by abnormal feelings of depression or euphoria. So they are like contrast. Depression is down in the doldrums, euphoria is on cloud nine. Okay, they are opposites, depression and euphoria, with associated psychotic features in some severe cases, which can be even violence. Okay, yesterday we also spoke that depression is not just that the person is going to sleep all day long. Some can be very flamboyant, they can be very aggressive also. Hmm? Disorders are divided into bipolar as well as depressive disorders. So if your arm is broken, you can get a cast, but if your brain is broken, you get outcast. What is depression again? The definition is a common but serious mental illness that affects daily activities. What do you define by daily activities? The people around you will be telling you, you used to move so fast. You used to finish this course so fast. Well, now what has happened to you? So you become a little slow in your day-to-day activities. Also, the things which amused you before will stop amusing you now. Very important to understand that things which really kept me happy earlier, okay, maybe the eating in a hotel with a friend, and now just I want to sit at home. So there are several types of depression. A general definition of depression and illness that affects moods, it affects thoughts, it affects your behavior, and then certainly it will affect your physical health also. And worst part of depression is that people who don't have it, they just don't get it. It means that they just don't understand what you're going through. And the worst thing you can be doing is tell them, look at the brighter side. See, that person doesn't have this also. You have so much. Come on, count your blessings. Then if you do this approach, you take this approach to a person in your house, he will stop sharing with you. Do you think he does not know that he has abundance? But that abundance is not what he is looking for. Please understand. Hmm? And it is not that just by a drive or something it will be gone. Depression is some chemical imbalance in the brain. And do you know the doctor gives you that small pill? Okay, some people say I'm very happy with this small pill, let me just continue. Doctor, don't reduce my, the psychiatrist has given me since around 5 years, 10 years, choti goli roj leta hu. So many patients tell me, do you know what is there in that pill? Dr. Pratibha Shinde, you can talk. What is there in that pill? And why do you feel happy after taking that pill, that depression goli tablet?
A
That's
drug which makes you temporarily happy. I
which
don't
is
know
that
that word.
which is that drug
Yeah, that word I'm not getting.
you're not getting? Okay, you tell me, it starts with what? Serotonin, madam, serotonin.
Serotonin. Serotonin.
So
It's
now you'll never forget.
C or S? Is it C or S?
Yes, or they also have dopamine, which is again a short-acting drug. So I'm not a psychiatrist, so I do
No,
not
but
know prescription.
serotonin.
I know they have mood elevators. Also, there is a very good.
Serotonin word starts with C or S.
No, it's SERO, serotonin. Okay.
Okay.
So there is one very, I am not getting her name, but she wears red frame glasses. I think she is Japanese. There's a great TED talk by her, and she tells you about exercise and senior citizens. You must see Wendy or some funny name she has. She's wearing red frame glasses, very lean and thin and short lady. But the way she speaks, that the exercise is the most underrated drug or unused drug for depression. Really.
Yeah, I believe. Because when I'm upset and when I go out, I feel so much better.
Yes.
For exercise, I mean, out
Now
means for
see,
party.
yesterday I was attending my teacher's meditation class. It comes after this thing, after I took your class. So I just changed my t-shirt and I sat down. Now I knew I had not eaten. I don't eat lunch before because then I get a burp in the class. So I prefer eating it very early, around 11:30 or something as a brunch or after the class. Okay, because I don't like to eat before the class. It shows up in the class, that energy. So I said, I'm going to eat also. I said, no, let me prolong for 1 hour. Then otherwise, how will I be able to do? So I purposely switched on the camera. My hair was open. I said, it's okay. But I switched on the camera so that I don't fall asleep. So that I listen to her. So that her eyes are on me. What is Divya doing? Is she getting up too many times? And then at 5, I ate my food. So sometimes even changing clothes, like I have this major thing. I hate going down.
because we have to change clothes.
That one,
Same
this
here.
one, then I'll tell the fruit wala, you go to that fellow and then you tell him this, and then some jugaad I do if somebody is not giving me things in the house, because I don't do online shopping. I don't know how to do. I have my trusted people like that. So even a simple activity of, now see, 2 weeks last week I fasted. I did a water fast. So I didn't go for my yoga class. So now again today my husband is saying, let it be, don't go, rest. Now next week for 10 days I'm not there. So again I will miss my class. So people will tell you. But then today I know I will change my clothes even if I have to take a cab and go. But I will go for that class and inform my teacher that for the next days I'm not there. I'll meet you after Diwali. Right? It shows a lot. The teacher also knows. The money is not counted. My husband is saying, you paid for the 6 months. I said, it's okay. I paid for 6 months so that I go for the class. But he said, I'm not there to get you back. He's coming home early. He's unwell. Then he's traveling. No, you have to do that job of getting up, dressing up, and showing up. Whenever you feel very low in life, tell yourself, get up, dress up, show up. Wear your best clothes. Go down. See how the mood changes. Okay? Because it is a vicious cycle. You'll not go for 1 day. Next day again, you'll say, I don't want to go down. Third day again, you'll think of some trick to get the stuff, or you'll make something which is existing in the house. Right? So you must do that. Little things only go down. You'll meet few people, you'll smile at the watchman, he'll get up and greet you. You'll realize you're a Setani. Okay, these little gestures also count a lot. Yes, sometimes I notice when I'm with my husband, they stand. When I'm alone, they don't stand for me. There are a lot of things you'll notice. Okay, these little things go a long way. Then depression is being colorblind because they don't have the power to see only those things which you are asking them to see, and constantly told how colorful the world is. Please, this is the worst thing, to be showing them what they have. Depression is living in a body that fights to survive with a mind that tries to die. So I think we used to have Kalyani ma'am. Her name was Vaidehi also and Kalyani also. And last time, I think maybe she doesn't come now. Very thin lady, South Indian. And she said that now I understand when you say that why my mother-in-law used to not go for a bath. And I used to keep telling her, go for a bath, go for a bath, go for a bath. So there is a lot of thing happening in their top floor. They have been telling themselves, I need to go for a bath, I need to go for a bath. But do you know how you can describe it? So on one shoulder, the devil is sitting, and one shoulder, the angel is sitting. Okay? The bad thoughts, the good thoughts. Okay? And then who's going to win? Who's going to win?
Bad.
If
Not
you go for
necessarily.
bath, then angel, and if you don't go, then bhoot, then devil.
Yeah. So
Depends on the who is heavier side.
who's going to win? The one who you give attention to.
Yeah.
Maybe you don't give your attention to the devil and you go. You just say, shut up. Come on, let me go. I'll feel much fresh after that shower. Right? I remember my friend. She's actually a kid. She says, my husband pushes me in the bathroom and he locks me from outside. Otherwise, I don't have a bath. I said, you have a great husband. I have to do that to my husband.
If I don't take bath, I can't eat my lunch.
I feel sticky.
Yeah, I can never eat. Then I say, I'm Hindu, I cannot eat without bhat.
Hindu. Yes, that's true. So the body is constantly trying to survive, okay, and the mind is trying to die. See, this is the example, the best example I can give you out here is the mind is gone, but the body is doing the day-to-day activities every single day. So it's a general, what are the symptoms? A general loss of interest or pleasure in most common day-to-day activities, feeling in a depressed, low mood most of the day, nearly every day, significant and noticeable. See, this is what you remember, Rita ma'am, weight loss or weight gain, either sleeping too much or alternatively not being able to sleep on a consistent basis. Means not able to sleep on a consistent basis and sleeping too much on a consistent basis. So slowed thinking or slowed physical movements that others notice. Okay, a feeling of worthlessness or an inappropriate guilt for unknown reasons. So guilt is important, but inappropriate, out of proportion to the situation, then that guilt gets imbalanced, and the worthlessness is the loss of self-esteem. Yesterday we were also speaking about, I told you that metabolic summit which I'm attending, kick off the sugar. So they are talking about why does a person have bulimia, why does a person eat a lot, why does a person, you'll remember the answer which I gave you all yesterday.
Low self-esteem.
Very good, very good. So a person, unless, so like there was another doctor who was saying his book is, don't come to my operation table. A cardiac surgeon's book is don't come to my operation table. So they asked him that if you're trying to reverse diseases by just kicking off sugar, he's saying cholesterol is not the culprit, it's sugar, it's insulin resistance. And so he said your patients will reduce. So he said, yes, I have a lot of patients, okay, but by creating these videos on YouTube, I'm spending money on all this. In fact, my resources are getting less and less. But the people who I operate a year now, in 2 years, they die from the same heart disease only. Isn't it beautiful to hear? He's operating on a person for a cardiac repair issue. And in 1 year or 2 years, the person dies from the heart disease only because doctors are not trained to evaluate or work on the source of the disease or the cause of the disease. So they will just do your symptom cleaning, next symptom, again symptom cleaning, annihilate those symptoms, but the cause is persistent. That's why ultimately you will die of heart disease only, unless you change your lifestyle. Making sense? Loses one's concentration periods or periods of being unable to decide. Feelings of tiredness, fatigue, or low energy levels every day. Most common reason for fatigue in doctor's chamber, which goes undiagnosed, is depression. It's not always a vitamin deficiency or sleeplessness, thoughts of death, suicide on a recurring basis. Very important to understand. I also gave you all the case of Malaika Arora's Khan's a month back. I think her father ended his life by suicide, jumping from this thing. And it was so upsetting because he was a very jovial man and he called up both Amrita Arora and Malaika Arora and he spoke to both his daughters. In fact, although he was a stepfather, they had a very good relation. And he said, I'm very tired. So, can you understand what he meant by I'm very tired? We also spoke about Ennui yesterday. Today, Jasmine Pittalwala is not there. We also spoke about what? Ennui. Ennui is something which is known as boredom. Okay. What are the illnesses which have similar symptoms to depression? So you should not be labeling any kind of mood disorder as a depression. If you have hypothyroidism, the one in which you put on a lot of weight. So thyroid problems also, the hypothyroidism can be mimicking depression. Or it can be associated with depression. Sleep disorders. Fibromyalgia is chronic fatigue syndrome when in the whole body starts paining. In fact, there's a triad of fibromyalgia with coffee addicts and with insomnia and depression. Fourth, Autoimmune disorders, we spoke yesterday, are associated or they can be mimicking depression because there is a mini Gogia. What answer did you give yesterday? Why autoimmune disorders? There, she's there. I did see her.
I'm here, I'm listening to you.
You heard her mention. So why do you think they are associated with depression? Because of the, I remember your answer yesterday's.
Vagus nerve, I said, gut-brain axis.
Gut-brain connection. Okay, the gut-brain connection. If one is affected, the other one is certainly going to be affected. In fact, there are cases of anxiety, panic attacks. Unless you work on the gut microbiota, nothing will change. So you can be on the depression, that tiny pill every single day, but unless you change your lifestyle, you change your food habits, improve the gut bacteria, and then lo and behold, the depression also the anxiety also subsides. That's why Hippocrates, the father of modern medicine, tells you that all diseases originate in the gut. Even eczema originates in the gut. Yes, we also spoke of some different kind of symptoms like withdrawal from family and friends, loss of pleasure, joy, lack of motivation, societal joy. Yeah, now some unexplained pains, headaches, muscle aches, or upset stomach, weight gain or weight loss, difficulty sleeping, irritable. So they can be aggressive also. Not all of them are very docile. Then there can be agitation. Yesterday I spoke to you. What example did I give you? That sometimes the power of the patient who is undergoing depression, there is so much power that he can also, Bolo, what do you remember from yesterday's class?
Lift up a whole cupboard.
Yes, yes, Maria. Very nice of you to remember that. Also, there are some lunatic asylums. In fact, when I teach about the Ho'oponopono prayer, you know about the Ho'oponopono prayer?
Yeah.
Yes. So the story goes about the Hawaiian doctor, the Hoon Lee, and he was assigned. I'm not going to teach you Ho'oponopono, but he was asked to deal with insane criminal lunatics. What is the meaning of that? Some of them are criminals, but they are lunatics. You know, they are not normal. That's why they have conducted that crime. They have committed that crime, not conducted. So those people are chained and kept because they are so dangerous. They are so dangerous. They poop over there only. They pee over there. They are very violent. They have to be chained and kept. Otherwise, they injure the doctor also. They will injure their roommates also. They are kept in separate chambers. So understand, depression can be very aggressive also. You can read. You must Google the story of Dr. Hoon Lee. So this is the slide I've put because of agitation. Now, we also spoke that there is the genetic, yes. So it is that, you know, how they say it runs, it's because the trauma runs in the family. Sometimes the trauma runs in the family and you'll see similar mental disorders in the family also. Then there can be it is definitely a brain chemistry imbalance which leads to depression. Sometimes poor nutrition, physical health issues, prolonged physical health issues is the adjective I would like to use because they are sustained, they are on bed, on bed. For this, I would like to remember that movie. There is a movie, if you all would love to see it. It's known as Guzarish. It's Hrithik Roshan and Aishwarya Rai. Any of you all seen it? He's immobile. He's just immobile. He's on bed. Aishwarya is his nurse. I remember seeing it in Metro morning show with a bottle of pop to a friend of mine and went and it's really nice. And Makran Deshpande is the husband, Aishwarya's husband. He's always into physical abuse and then she leaves him and she marries Hrithik Roshan. Because although he's having a prolonged illness, she has to literally clean him for everything, but still she marries him. There is no physical consummation of that marriage, but then still she wants to marry that man because it's a marriage in thoughts. You must see that movie. How Hrithik Roshan this thing acts and how she also comes to him with every single day she dresses the best of in the best of her attire to See, it is so important for caregivers also to be having the best of clothes, the best of. She puts red lipstick, and even if she's unhappy, then she comes in front of him. Because
What's the name? What's the name of the picture?
Bizarrish.
I have seen it. It's a lovely movie.
Sorry.
You'll cry the whole
Thank
movie,
Yeah, yeah.
but you'll understand how she also wipes her tears, and then she comes in those, those white and black and those red skirts kind of things. The Jab We Met, what Karina wears. I love those attires. They are the pinafore kind of things. So for the caregiver also has to be having a good mood. A grumpy caregiver, you've had it. One second. Just give me a minute. I somehow lost my slides. Yeah. So it can be because of physical health issues, drugs, as well as stress. Some common, yes, we also spoke a lot about childhood depression can be recognizable. Some common symptoms can be changes in weight, disturbance in sleep patterns, unusual and persistent sadness or irritability, sudden loss of interest in activities they once enjoyed, especially the games, the friends, sluggishness, and lower self-esteem, hopelessness, and thoughts or attempts of suicide. The youngest age yesterday we discussed was 6 years. Now, what are the types of depression? Major depressive disorder, persistent depressive disorder, which is what we are studying, postpartum also, and I have slides for the same. That is after delivery, the mother's chemical imbalance gets upset and she goes into a stage of depression wherein she does not feel any kind of love for the child. Premenstrual dysphoric disorder, what is this? Is because the body shape changes. Okay, post ovulation to the time you menstruate, there is dysphoria. The body puts on a little bit of edema, this and that, and your face also gets a little puffy. So a person can be premenstrually also a little low. Now this is sad. Sad is seasonal affective disorder. So there are some areas, some continents wherein the sun does not shine for 2 months. Okay, there's no sunshine, and that's why we call the sun the sunshine vitamin. It's known as seasonal affective disorder, and this is very difficult to understand and pick up. Atypical depression, it does not present like the clinical symptoms you're taught in the book. We spoke a lot about that. Jim Carrey also, he laughs a lot, and then you hear in the papers, you read in the papers that he's ended his life. Now, effects on the body. What can it have? Effects on the body. So, there can be insomnia, headaches, fatigues, chronic pain, diarrhea, or constipation. Remember, that's why IBS, irritable bowel syndrome, always connected with stress. Usually, ladies experience this because it is known as unresolved, unrequited, and unrefined stress. So, stress is there to everybody. The way you manage it is important. Otherwise, you'll get diseases. So, there is inflammation. There is inflammation in the knees also. You'll take a lot of drugs, but it doesn't subside. The knee pain doesn't subside. Then consider, are you chronically depressed person? Increased risk of heart disease, weight loss or weight gain, and loss of libido, that is no desire for coitus, or dyspareunia is painful coitus. Physical effects: increased aches and pains, chronic fatigue, insomnia, oversleeping, lack of appetite, loss of libido, changes in the brain chemistry, changes in weight, change in relationship to food. Very important to understand what you liked before, you don't like it now. Decreased memory and increased cortisol. Cortisol is your stress hormone. Then you can also be having consistent nausea. You can be having bloatedness, sometimes unresolved. You don't know you're eating good food, still you have bloatedness. Okay, aches and pains, and high blood pressure. Now, let us understand this category. We spoke about depression in children. Let us understand depression in men. It's very, very, very different. Okay. And because men usually don't share, men usually don't, they are not, we feel they can manage their things on their own. We feel they don't have something to share, but it's not that way. So symptoms can be anger and agitation. Suppose a male is showing these symptoms, maybe your son, maybe your spouse is showing symptoms of anger and agitation. The causes can be difficult life events. If the person is suddenly very reckless in his activities, there can be a family or a personal history. If there is substance abuse, there can be causes of abuse. Suddenly you are taking up something to find solace in that drug. Working obsessively. These are known as causes of personality traits. Maybe they are running away from the house. Maybe they are trying to escape some bad relationship. Maybe they are trying to escape the nagging wife. So working obsessively is also an escapism to all that. Hmm? And there can be core symptoms of depression. Again, it can be associated with physical health issues. Which is the physical health issue commonly associated with depression? Hmm? Common.
Low blood,
Hmm?
low blood pressure,
Depression, diabetes, both
diabetes.
the
Okay.
Ds, both the Ds. Observe them. You observe them. Suddenly they'll be very low in their face. Observe them. Okay, let's move further. Now, very important to understand if your vitamin D levels are proper or no. So in adults, vitamin D deficiency isn't obvious, okay? But you might have mood changes. Again, it's a vitamin D deficiency. If there's bone loss, if there are muscle cramps, it's not just only magnesium, vitamin D also. And if there's chronic fatigue, if there's bone and joint pain, especially in your back, are you vitamin D deficient? So a good doctor, when you go to the ortho, when you go to the physio, he needs to ask you, have you maintained those levels? And remember, if you have quit your, if you have stopped eating your oils, your ghee, okay, clarified butter, vitamin D will not be absorbed because it is oil soluble. It is not water soluble. You need a little bit of oil in your daily diet also to synthesize or to absorb that vitamin D. Okay, the body only makes it with the help of sun. But if you have low levels, don't think if I sit in the sun for hours together, it will not help. You need a supplement. Okay, take proper supplement 6 days, 6 weeks, and then you can maintain it with that. But it's a good idea to be taking a supplement. Then, when people know, when people don't know exactly what depression is, they can be judgmental. What is the meaning of this? What do you mean they can be judgmental?
They like to come with their own theories of depression.
Yes. So yesterday I didn't tell you all, but earlier I've always spoken to you all about Deepika Padukone. She mentions that she experienced, hi Shruti, depression when she was at the pinnacle of her career. She was most successful. And she kept crying. She has those bouts. See her video on YouTube. Patiently see it. And she said her mother had come to visit her, and her mother picked it up and quickly took her to the shrink and the counselor, and then she was out of it. So that's why we ask these great personalities to speak about it. Yesterday, that's why I was always saying, when you get a fracture, you get a cast, but when your brain is fractured, you become outcast. But today, if we see a Deepika Padukone talking about it, okay, there are other personalities also who come up and talk about it. Okay, so we will not be shying about it, and we will understand that it's not because I'm unsuccessful, that's why I'm deep down in the doldrums. No, it's a chemical imbalance in your brain. So people can be judgmental, like, these urban people, they only get depression. I told you all, no, my maid's daughter. Now you may think that the depression is a disease of the urban people because they have everything. It's a disease of abundance. No, but she had postpartum depression and she ended her life through suicide. I have slides for the puerperal depression also. Then let us understand what is sadness and what is depressed. They are both very depressed, very different. Okay, this is really a good slide. This is what sad looks like. See the emoji, and this is what depression looks like. So a quick song is तुम इतना क्यों मुस्कुरा रहे हो, क्या गम है जिसे छुपा रहे हो. So they will keep smiling, but you will not come to know that they are depressed. Then depression isn't sadness. It is not dissatisfaction with life. It's not an excuse for anything. It's not a choice or a decision to or a reason to for being lazy. There are a million things depression is not. And only one thing depression is a sickness. Right? So now see this. This is very important. God, I studied so hard. Let us differentiate between depression and sadness. So this is a period of sadness. This boy has flunked his exams, but he will come out of that sadness episode. But see this. Similar, this boy has also flunked, but see what is going on. The mother is saying, my son seems to have lost all interest in his studies. It's been a month since he's going to college. He does not speak to us at all. I'm really worried. And what is the boy thinking? My parents are always quarreling, and this bothers me so much. I don't feel like studying or doing anything else. I don't have a future and I hate my life. So, withdrawing from family and friends, loss of interest in activities. So, this is a pure case of depression. But the mother will not be able to understand it. So many of us have this inner child trauma within us, and we are not able to pick it up in the child. So understand that you have to differentiate between sadness and depression. So sadness is universal. All of us in some point of our time are going to be feeling sad. Depression, not everybody undergoes. It's not universal. Feelings of sadness come and go. Depression, it involves persistent feelings of sadness and hopelessness that continue for more than 2 weeks. Sadness is usually brought on by a trigger or a specific event, and depression can be linked to a specific external trigger that isn't always the case. It is just a chemical imbalance. Sadness is, sadness can certainly affect how we go about our daily activities, but its impact isn't all that severe. And depression significantly interferes with impairing our ability to function day to day. A simple thing like a bath, we will procrastinate. Now let us compare grief and depression. So again, grief is deeper sadness. There's difficulty practicing acceptance, seeing or hearing things related to the loss. And depression is just persistent or everything with suicidal ideations. And similarities, both can be having intense malaise, sleeping disruption, loss of appetite, and weight loss. So characteristics of anxiety now, persistent worry or fear that interferes with things they would normally do, but an anticipatory kind of an anxiety. Okay, and depression will be what we already know, withdrawal from social interaction. Now depression is when you don't really care about anything, there is indifference. Okay, and what is anxiety? It's when you care too much about everything, and having both is just like hell, because people who are suffering from anxiety will be clubbing it with depression. There's no other way out. Depression will set in if you are hyper anxious. And in case you are having both, it's living in hell. And what is the depression between sad and depression? Is like, now, if you compare sadness and depression, it's like there's a difference between the weather and the climate. So I've put a definition of what is the weather and the climate too. So in fact, if you know someone who's depressed, please resolve never to ask them why. Depression isn't a straightforward response to a bad situation, or a depression is just like the weather. So let us understand what is the weather. So weather is a combination of temperature, humidity, rain, that's precipitation, cloudness, visibility, and wind. That's a particular weather. And climate is the weather of a place averaged for over a period of time, often 30 years. So we say Darjeeling has this kind of climate. So what are mood swings? A severe mood swing is an abrupt change in emotion, and depression is again long-term period of sadness regarded as a serious illness. And what depression looks like, depending on factors like age and sex, depression could present differently among different group of people with the disorder. Some people may experience more passive symptoms while others experience more explosive ones. Right? So 8 signs of depression: anxiety, hopelessness, very important. They are really hopeless. And it's difficult to reinstall that hope in them. Mood swings, changes in body weight, uncontrollable emotions. See, this is the aggressive form of depression. Feel low, insomnia, and suicidal tendencies. So, emotional symptoms, again, a lot of guilt. Physical symptoms: change in psychomotor skills, change in appetite, decreased concentration, lack of energy, change in sleep. And associated symptoms, let us study now, can, as I just told you, anxiety or phobia, tearfulness. They don't know why they are crying. Excessive worry over physical health. So they can become, does anybody know the word which is used for this? Excessive worry over physical health. What are they called? Pain, irritability,
Hypochondriac.
excellent. They are known as, they go doctor shopping. So I have patients who come with me with 25 kilos of files. They come with a nice shopping bag. They go doctor shopping with that bag. So they are known as hypochondriac. All the time they are thinking about, in fact, negatively about their physical health. Okay. And so it's obsessive rumination. Now, what are this? Yes, there may be something else. Here, low confidence. Okay, they are all similar symptoms. Yes, loss of interest in enjoyable activities. Very important. So the others will be happy, but this person will stay away. So this is the types which I explained to you all. Postpartum, I told you all. Sad also, I told you all. Seasonal affective disorder. So bipolar diseases, let us define. So psychosis is what? It is,
Disconnection from reality.
yes, my dash to discover. Yes, disconnection from reality. Bipolar disorder is, read, Ganesha Girija Ganesh.
Extreme mood swings that include emotional highs and lows. Mania and depression. SAD is depression that occurs at the same time every year. Occurs in climates where there is less sunlight at certain times of the year. Much more than the winter blues.
Yes.
Major, yeah. Major depressive disorder, clinical depression. Persistent depressive disorder, what's that? Dysthymia, milder but long-lasting form of depression.
Persistent, that's the word given. So according to Mayo Clinic, postpartum blues may seem like, okay, I'll skip postpartum because, okay, let's try. Women experiencing postpartum depression often feel much pain during a time that should be joyful. So people will keep telling you, "Arey, the baby's cute, cute, cute," but then you don't feel any love for it. Many are reluctant to tell someone when they feel this way, and postpartum depression is a medical condition that requires attention as well as treatment. So this, why it needs to be taken into consideration, is because it will eventually impact the mother's ability for caring to her baby. Okay, it's not an indicator of being unfit as a mother, but instead it's a complication of giving birth. Often postpartum anxiety occurs with postpartum depression, anxiety. Okay, and may last as long as more than a year after giving birth if left untreated. So these are the baby blues. Which person comes out? Mood swings, overwhelmed, crying, no thoughts of suicide. But in postpartum depression, there will be certainly thoughts of suicide, excessive crying. You will feel inadequate as a mother, not enjoying the things that used to bring happiness. Occurs anytime within 1 year, lasts for more than 2 weeks. Okay, we'll skip this slide. This also we learned. I want to take you all more about this. So what is the depression means? Feeling severe despondency, breakdown. Okay, opposite of depression can be ecstasy, jovial, jolly, upbeat, joyous. These are the adjectives. Okay, lively, jubilant, and content, blissful and elated. So, when you suffer from depression, usually we say it's I'm tired, okay, but it means a permanent state of exhaustion that sleep doesn't fix. Remember, I told you he called up and he said, I'm tired, means a permanent state of exhaustion that even prolonged sleep cannot fix.
Going somewhere?
Okay. Then there are tips for caregivers. Obviously, if you are uh, unwell, you cannot take care of your patient. Healthy diet, enough sleep, regular exercise. Talk to your family and friends. Think positivity. Don't blame yourself that, oh, I have been like this. That's why my patient, my relative is suffering from depression. No, it keeps coming. It's not that you're a bad mother or something. Do what you like. The caregiver has to be mentally balanced, keep calm and help others, and meditate. The caregiver needs to take care of his health. Now, very important slide. This is the way a brain looks in depression, and this is the way a brain looks in no depression. So today, I want you all to be convinced that it is a brain chemical, which is the best word, imbalance, locha or
Imbalance.
okay. This is no depression and C depression. So why can't you control yourself and try to be like a normal person? No, a bipolar's brain looks like this, whereas the normal brain looks like this. It's a brain disorder, my dear friends. It's not something that you supplement, not something that you go to the astrologer, not something that you go to the temple and you fast for so many days and you do this puja and that puja. It will not go.
That means only medication can help them.
Yes. Yes. And you're wise enough, go to somebody who's trained. So, what are the other mental diseases which are a problem of chemical imbalance? It's schizophrenia, anxiety disorders, and delusions. So, these are very deep. Now, how to manage depression? So, one way is CBT or cognitive behavior therapy or psychotherapy. Then there are self-help strategies wherein I told you exercise is the most underrated drug. Okay. And then there is last resort to medication. So psychotherapy works very well if a patient is in a state of sharing. Okay. Many people don't in depression don't want to share. Okay. Self-help strategies also work if the person is having the desire to come out of it. You can't be helping somebody who doesn't have a desire to be coming out of it. So family or couple therapy, if it's a family issue, if it's a dysfunctional family, you can go in for couple therapy or psychotherapy. Now, so hygiene is very important. Paying attention to your behavior patterns, sleep. See, this suicidal ideation of I ought to be dead. This a person has to deal with a lot. Otherwise, it will keep coming. Risk factors can be previous suicide attempt, mental disorders, substance abuse disorder. You have to be very vigilant with these kind of patients. Family history of suicide, hopelessness, impulsive and aggressive tendency, isolation, and debilitating physical illness. Now, what is a depression first aid? Okay, so what to do and what not to do. So, what you must do is check in to make sure if they are safe and coping okay. You should not be saying you are attention seeking. That's why you're calling me up so many times in a day. If you have person suffering from depression, don't think that they are attention seeking. Check on them. Then, what you should be doing, listen to them with compassion and patience and understand them. Do not judge or criticize them and call them weak. What you should be doing, recognize they have a real illness, they are fighting, and they commend them for their strength each day. Take baby steps and commend them. Today you had a bath quickly. Good, great. Tell them, don't tell them to just snap out of it because you believe they are only experiencing sadness. Very important. We do this advising. Then what we should be doing, do a nice activity together, like watch their favorite movie, take them out for coffee, and do not leave them to fend for themselves because you believe they chose to be like this, they chose to be having depression. No, please don't push those with depression away. Be the one who supports them though through it. Okay. Now, what is this? 5 items which you should be having on your emotional first aid list. Take this screenshot of this slide. Very important. So you should be having this emotional first aid kit in your phone, in your wallets. So have a playlist of songs that uplift and empower you. Like I love my Nusrat Fateh Ali Khan, I love my Badshah in the morning. I love all these violent and jungly songs in the morning. That's the way I'm able to reach to my class at night, because I finish everything. An image that suits or makes you smile. Don't you know you all keep your grandchildren photo on the mobile? Hmm? A scent that you enjoy or try an essential oil. Very important. Keep your that lavender smell, that chamomile. Have a burning candle. Smells also uplift your mood. A list of people who love you as a reminder. Many times we feel very worthless. Okay, so have a list of people in your phone. Create a separate chat on your WhatsApp and have a list of people who've given you good compliments. Okay, keep them, read them sometimes, you will feel nice. And a journal or art supplies to process your feeling. Very important to be vomiting out on paper, writing your issues down on paper, and the universe resolves it for you. Okay, now what else can we doing? This is what you all are doing. You all are learning at Get Set Up, you all are painting, you all are making crafts, you all are dancing. So whatever passions which you have not pursued as a child, please pursue them now. Increase meaningful socialization means join yourself to associate with a voluntary organization, volunteer for a purpose, because haven't you seen? Haven't you all read about about Ratan Tata, that message which has been circulating? So he said no. He was asked to donate wheelchairs to some children. Yes, you all know about it. So one child, they asked him to donate with his own hands those 200 wheelchairs. One child got hold of, see, we don't know. WhatsApp factory is very fictitious, but if you get something to learn from it, nothing like it. So one child held his hand and said, "I'm trying to remember your face so that when I meet you in heaven, I should be able to recognize you." So these altruistic activities. I have taught you all about the neuroscience of happiness, the workshop which I take, neuroscience of happiness. Very important to associate your life with some purpose, with some meaning, with some purpose. Okay, and then that is actual. What is the happiness? It is known as eudaimonia or eudaimonic happiness, which is everlasting happiness. And the other one is the hedonism or hedonist happiness, which will subside. You buy a good outfit, it will subside. You buy a Merc, a good car, it will subside in a week. But that is everlasting happiness. So volunteer and associate yourself or join some organization which is doing these benevolent kind of activities. Stick to a schedule. Very important, stick to a schedule. And I'm seeing many seniors who, if suppose I go for a walk also, they are always there. They stick to the schedule. Very important. Then self-help strategies, exercise, relaxation training, light therapy. Okay, be in light. As I always told you, change your clothes, go down for a walk. Self-help books based on cognitive behavior therapy, computerized therapy treatments. Okay, and then you can text a mate. Never ever underestimate. If one friend has not supported you, text another person, another relative. Please remember Parveen Babi's case. That lady was such a good actress, and then what happened? Although she had a lot of alcoholism abuse and other things, but always learn to reach out for help. Learn positive coping strategies, the simple spa, hot water showers or cold water showers, whichever suit you. Set small goals, set small tangible goals which you can learn. Now see, learn something new, because challenge your brain. Let you learn a new instrument, a musical instrument. Get creative, join a support group. Facebook has so many support groups of similar people, and develop a healthy sleeping routine. Coping skills can be get a hug, drink water, create art, eat healthy, exercise, drink tea, take a bath, play with your pet, learn something new, read a book, drink tea, and cry. What can be coping skills for these are for children? Let me skip. Simple. Get out. 5 ways to cope with depression. Get out and get sunlight. Express yourself with writing. Stay connected and involved. Keep a list of your strength and win. Very important. When you're feeling down, open up that WhatsApp chat and read. I have done this. I have achieved these things in life. And create a wellness toolbox, which I earlier explained to you all. What is the meaning of Retired. You guys are all retired. So relax. What is the to-do list? Eat well, eat healthy, travel, indulge in what you like, but with proportions. Read, explore, and drink from elixir wine. Okay. Then stress-free life again. Stay fit. Write a book or a memoir. Get a part-time job. Yes, this is very important. Sometimes you feel, no, I was the CEO of an office. How can I work as a in a hotel, the cashier? It's okay. It's okay. Go there. Do something for charity. Do it free of cost, but go out of your house. Downside your home. Matlab, become minimalist. Reduce the quantities of your belongings. Research your ancestry. Yes, stress-free retiree. Enjoy hobbies, learn something new, socialize with friends, take advantage of senior citizen deals. Yes, good deals for travel, and volunteer in the local community. So, this is a last slide. I have depression, but I prefer to say I battle depression instead of saying I suffer with it, because depression hits, but I hit it back. Battle on. Okay? Hit it back. So, combating our neurosis and paving the path to a better life for ourselves is the heaviest and the most rewarding part of life. Depression is a concrete illness which affects everything in a person, right from the diet to the productivity. Depression is not to be confused with a passing mood or a bad phase. In order to be diagnosed as depression, your mood needs to be lasting for more than 2 weeks. So, this is the best we could be doing in 2 hours. It could go on for a third hour also, but then if I take it to next week, none of you all will remember what we taught in this week. Okay. So you can also be forming your little learnings. You can be writing them down. Okay. And we meet on Friday for a yoga class in the morning. It's again on lying down asanas at 9 a.m. Thank you for the gift of your time, energy, and attention. And bye bye.
Thank you,
Thank
Dr.
you,
Deepika.
ma'am.
Thank you so much.
Thank
Thank you
you
so
for
much.
teaching us.
Thank you.
Very good. Thank you.
Excellent.
Thank you, ma'am.
Thank you, doctor.
तुम्ही ह्या बाजूला जर दिलं ना
बापरे केवढं ज्ञान आहे.
पुरेसं झालं नाही ना तुम्ही दिले ना एक 1/2 किलो